Coronavirus disease COVID-19 is an infectious disease caused by a newly discovered coronavirus. Most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. The best way to protect, to prevent, and slow down transmission is to be well informed about the COVID-19 virus, the disease it causes, and how it spread. Protect yourself and others from infection by washing your hands or using an alcohol-based rub frequently and not touching your face. The COVID-19 virus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. So it's important that you also practice respiratory. The coronavirus symptom is divided in 3 levels. The first level is most common symptom. It is fever, dry cough, tiredness. Secondly, symptom is less common symptoms. Head and pain, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, and a rash of skin or discoloration of fingers or toes. The last symptom is serious symptom is difficult breathing or shortness of breath, chest pain or pressure, and loss of speech or movement. To prevent infection and to slow transmission of COVID-19, do the following. Number 1 is wash your hands regularly with soap and water or clean them with alcohol-based hand rub. Number 2 is maintain at least 1 meter distance between you and people coughing or sneezing. Number 3 is avoid touching your face. Number 4 is cover your mouth and nose when coughing or sneezing. Number 5 is stay home if you feel unwell. Number 6 is refrain from smoking and other activities that weaken the lungs. The last is practice physical distancing by avoiding unnecessary travel and staying away from large group of people.
Alright, thank you to my friend Amin for the explanation about the general definition of COVID-19. Hello, my name is Nazim. My matrix number is 23DLS20F2034. So in this video, I would like to explain to you guys about a silent carrier, or in another term we call it as asymptomatic. And this silent carrier or asymptomatic is very related thing with the COVID-19, pandemic COVID-19. So silent carrier is actually a people who are already infected with the coronavirus, but they show no symptoms or even a little symptom. So then they carry out their daily life, meeting their family members, meeting their friend, meeting their office mate, okay, and spreading out the virus without their own knowledge. And there are actually 3 stages of asymptomatic, or maybe we call it as a silent carrier, which is the first stage is mildly asymptomatic, the second one is a pre-symptomatic, and the third one is asymptomatic it is. So mildly symptomatic, the lowest stage in the 3 type of asymptomatic. This stage is where the people just show a little symptom, maybe like a light cough, a light fever under 37 degree, okay. So this stage, the people still feel well even though they show a little symptom. And pre-symptomatic is a people who don't show any symptoms after a week being infected. So after a week being infected, then the symptom will come out to their body. And the last stage and the most dangerous stage in the asymptomatic carrier or in the silent carrier is asymptomatic. So this stage is actually where the people never show or even feel the symptoms, so they don't feel anything, but actually the virus is inside their body. So this is the biggest reason why we have to be more careful, because we can't even know who is actually carrying the virus. Maybe we ourselves actually carrying the virus, or maybe people around us who seems in a good condition. So the summary and the conclusion here is asymptomatic is actually a people who are actually already infected with the coronavirus, but they don't know. They didn't know that they actually infected. Okay, they feel very, very well. They feel healthy. They don't feel any symptoms, or maybe they feel a little symptom, just a light fever, a light cough, no, not a big deal for them. So they think that they not having COVID-19. They just think that it's a small matter. So there is asymptomatic. So when they think that they are good, they are in a good condition, so they can free to get out from their house, meet their friends member, meet their family, meet whoever they want, and actually they are spreading out the virus with their own knowledge. Alright, so please guys, stay safe in this pandemic COVID-19. Okay, please, if you guys don't have a necessary reason to get out from your house, just please stay at home. Okay, but if you have to, then please don't involve yourself into the crowd place, because it's a high risk place for you to get infected by the COVID-19. Okay, and also please follow the SOP, wearing a mask, hygiene your hand with the hand sanitizer. Okay, so please, we are not win the pandemic yet, but we will win one day. Okay, discipline is the most important thing. Okay, stay strong guys. Okay, trust ourselves, we can win this. Okay, so that's all for me. Thank you. Assalamualaikum.